Hi, I'm Dylan. I'll be recording this session.
First, I'm going to knock on the door. I'm going to wash my hands. I'm going to introduce myself. Hi, my name is Nicole. I am a nursing student and I'm going to be doing a full head to toe assessment if that's okay with you. Perfect. I'm going to start by verifying the patient's name and birth. So can you tell me your name and your date of birth? Perfect. Alrighty, so I'm going to start by asking a few questions. Do you know what month it is? And do you know where you are? And do you know why you are here? Okay, perfect. So my patient is alert and oriented to person, place, time, and situation. My patient's speech is clear. My patient appears stated age of 60 years old. They are smiling. They don't seem to be in any distress, and their behavior is calm. My patient's posture is midline. They are able to get in and out of bed. They are not using any assistive devices. And they do not have any involuntary movements. My patient's overall grooming and hygiene. My patient's hair is clean and combed. My patient just took a bath, so they smell fresh. My patient has on a new gown. So now I'm going to assess my patient's vital signs, and I'm going to start by taking my patient's apical pulse, and I'm going to do that at the mitral landmark. I'm going to go to the left side of the chest, fifth intercostal space, mid-clavicular line. I'm going to assess this for a full minute. My patient's pulse is 60 beats per minute, and the rate and rhythm is good. Next, I am going to assess my patient's radial pulse. I'm going to assess this for 30 minutes. I'm going to assess this for 30 seconds and multiply it by 2. Unless my patient has any arrhythmias, then I would assess it for a full minute. My patient's pulse is 60 beats per minute. Normal pulse range is from 60 to 100 beats per minute, and they have the radial pulse is a good rate, rhythm, and a 2+ force. Next, I am going to assess my patient's respirations. I am going to assess this for 30 seconds. Multiply that number by 2. I'm going to watch for a full rise and fall of the chest. My patient's respirations are 16. Their breathing is unlabored and easy. Normal respirations are between 12 and 20, so that is normal. Next, I'm going to assess the patient's blood pressure. And I am going to place the blood pressure cuff on the upper arm. I'm going to locate the brachial artery, place my stethoscope on the brachial artery. I'm going to pump up the cuff, and I'm going to measure for a systolic and diastolic reading. The patient's blood pressure is 120/80, which is normal. Next, I'm going to assess my patient's oxygen. I am going to place a pulse oximeter on the patient's finger, and the pulse ox is reading at 98% in room air, and normal is between 95% and 100%. Next, I'm going to assess my patient's temperature. I'm going to do an oral temperature because my patient has not had anything to eat or drink in the past 30 minutes, and my patient is able to fully close their mouth. My patient's temperature is 98.6, which is normal. And I would do a tympanic in the ear unless my patient had any drainage or any ear pain. I would do a rectal temperature if my patient, if the doctor wanted a more accurate reading. And I would do an auxiliary temperature if oral and tympanic were not available, unless my patient was not able to fully close their arm. Next, I am going to assess the overall shape of the patient's head. The right and the left are symmetrical. I'm going to assess the patient's hair and scalp. The hair is clean and there is no dandruff on the patient's scalp. Next, I am going to palpate the patient's scalp for any masses or tenderness. I don't feel any. Next, I'm going to palpate the patient's carotid artery. I'm going to do this one at a time, but I'm going to do it on both sides. And the carotid artery has a good rate and rhythm with a 2+ force. Next, I'm going to palpate the lymph nodes. I'm going to start in front of the ear, and I'm going to palpate the preauricular, behind the ear, post-auricular, occipital behind the head, and tonsillar under the jaw, under the ear by the jaw, submandibular under the jaw, submental under the chin, anterior cervical on the neck, posterior cervical behind the neck, and then I'm going to do supraclavicular above the clavicle. Next, I am going to assess the patient's eyes. Their eyes are symmetrical, the eyebrows are even, the right and the left are symmetrical to each other. There's no eyelid drooping, no drainage from the lacrimal duct. I'm going to pull down the skin of the eyes to check the conjunctiva, which is pink, and the sclera of the eye is white. Next, I am going to do perla. I'm going to dim the lights, and I'm going to see that my patient's eyes are dilated at a 5, and they constricted at a brisk 4. And then I'm going to ask my patient to keep their eyes on the tip of my pen as I move it towards their eyes. Alrighty, my patient's pupils are equal, round, and reactive to light and accommodation. Next, I'm going to do the extraocular eye movement. I'm going to ask my patient to keep their eyes on my pen as I move my pen to just move their eyes and not their head. We're going to go up, and down, over, down, up, over. Okay, so my patient's extraocular eye movements are normal. I'm going to go ahead and turn the lights back on. Next, I'm going to look inside my patient's ear. I do not see any drainage or any lesions. I'm going to go ahead and pinch the auricle. I'm going to pinch the lobule and the tragus. My patient has no pain or tenderness. And while I'm on this side, I'm going to assess my patient's hearing by doing the whisper test. I'm going to take a step back. I'm going to whisper a word. Nurse. My patient is going to repeat back, nurse. And then I'm going to go to the other side, and I'm going to do the same steps. I am going to look inside the ear. I do not see any drainage or any lesions. I'm going to pinch the auricle, the lobule, and the tragus. My patient has no pain or tenderness. I'm going to do the whisper test, taking a step back and whispering a word, moraine. My patient is going to repeat back, moraine. So based on the conversation with my patient's hearing is good. And now I'm going to assess my patient's nose. I'm going to assess for patency. I'm going to have my patient close each nostril, one at a time. My patient has good airflow, no nasal flaring. I'm going to look inside the nose, and the mucosa membrane is nice and pink, and the septum is midline. Next, I'm going to look inside the mouth. I'm going to see that the buccal is pink, and the sublingual is pink and moist. The hard and soft palate are intact. My patient has no missing teeth, no loose teeth, no decayed teeth, is not wearing any dentures. I'm going to use my tongue depressor, and I'm going to push down on my patient's tongue, and I'm going to ask my patient to say, ah. The uvula has vibrated, the uvula is midline, and the tonsils are normal. Next, I'm going to have my patient perform a range of motion with the neck. I'm going to ask my patient to demonstrate with me as I tuck chin, raise head to the ceiling, turn head left ear to shoulder, right ear to shoulder, turn your head left and turn your head right. We're going to do the same thing against resistance, turn right and turn left. My patient's resistance is normal. Then I'm going to say that my patient's mode of breathing is through their nose. They're not using any accessory muscles. They're not using their abdomen, ribs, or shoulders. Also, their neck is symmetrical. Their shoulders are even, and the trachea and substernal notch are midline. And my patient has no cough or sputum. And then I'm going to assess my patient's jugular vein distension And to do this, I'm going to have my patient lie in a supine position. I'm going to check with my pen light. My patient has no bulges or invisible pulsations. If my patient did have a jugular vein distension, I would have them sit in an upright position to see if it went away, but my patient does not. Next, I'm going to assess my patient's extremities. The patient's overall skin color is normal to their ethnicity. Hair is distributed evenly. I am going to assess my patient's temperature with the backs of my hand, and the temperature seems to be warm. Next, I'm going to assess my patient's fingernails. The fingernails are clean and pink. I'm going to do capillary refill on each finger, and it's less than 3 seconds. I'm going to do the same thing with the other hand. I'm going to assess the patient's nails. They are clean and pink. I'm going to do capillary refill on each finger, and it's less than 3 seconds. I'm going to do the same thing on the toes. The nails are pink, nice and clean. Capillary refill on each toe. It's less than 3 seconds. Next, I'm going to assess my patient's pulses. I'm going to assess the radial pulse on the wrist. I'm going to assess the femoral pulse, which is at the groin. I'm going to assess the patient's popliteal behind each knee. And I'm going to assess the posterior tibial and the dorsalis pedis. All the pulses have a equal rate and rhythm with a 2+ force. Next, I'm going to assess my patient's chest. I see that my patient's chest is flat. It is symmetrical. I'm also going to do the chest expansion, put my hands on the patient's chest, and ask the patient to take a deep breath in, and my hands separated symmetrically, and my patient has a normal depth. Next, I'm going to palpate the patient's chest, and I'm feeling for any masses, any tenderness or crepitus, and my patient has none. Next, I'm going to palpate the 5 cardiac landmarks. I'm going to start on the right side of the chest next to the sternum, second intercostal space for aortic, left side of the chest, second intercostal space for pulmonic, third intercostal space for Erb's point, fourth intercostal space for tricuspid, and then the fifth intercostal space, midclavicular line. And I did not feel any midclavicular line for the mitral, and I did not feel any heaves or thrills. Next, I'm going to auscultate my patient's lung sounds. I'm going to use the ladder technique. I'm going to do this posteriorly, anteriorly, and laterally. I'm going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And all lung sounds are clear. Next, I'm going to auscultate the patient's 5 cardiac landmarks, again starting at the right side of the sternum, second intercostal space for aortic, then the left side of the chest center in the second intercostal space for pulmonic, the third for Erb's point, the fourth for tricuspid, and then the fifth intercostal space midclavicular line for the mitral. And all heart sounds are normal. Next, I'm going to go ahead and assess the patient's abdomen. Okay, and I'm going to assess the overall contour is flat and softly rounded. The pigmentation and color is normal for the patient's ethnicity. I do not see any scars, striae, masses, bulges, petechiae. The umbilicus is midline. And now I'm going to auscultate the patient's abdomen. I'm going to start at the right lower quadrant, going up to the right upper quadrant, to the left upper, and to the left lower. And all bowel sounds are active. Next, I'm going to palpate the patient's abdomen, again starting in the right lower quadrant, moving in a clockwise position. And I do not feel any masses, there's no tenderness, and I feel no pulsations. And next, I'm going to assess the patient's genitals. I see that my patient has nice healthy tissue. There's no lesions, there's no drainage. My patient's urine is straw yellow, and my patient's stool is brown and formed. Next, I'm going to assess the patient's musculoskeletal. I'm going to assess the overall skin color and pigmentation of the skin is normal for the patient's ethnicity. Texture is normal. I'm going to have my patient get up and walk around, and I'm going to observe their gait. Their gait is even, no tics and no tremors. I'm going to have my patient do the Romberg test while they stand in an upright position and close their eyes. My patient has no swaying and good balance. I'm going to assess my patient's muscle tone. I'm going to assess their muscle tone. Their joint shape is good. I feel no masses, no tenderness, no edema. I'm going to do the same thing on the lower extremity. Muscle tone is good. Joint shape is good. No masses, no tenderness, no edema. Joint shape is good. And I'm just going to make sure that they are symmetrical on the other side. Muscle tone is good. Joint shape, no masses, no tenderness, no edema. And then same thing with the other extremity. No masses, no tenderness, no edema. Muscle tone is good. And both right and left are symmetrical. And I'm going to have my patient squeeze my hand for muscle strength, which is good. I'm going to have my patient push down on my feet, and that is good, and push up on their toes, and that is good. And then I'm going to do the patient's pain to touch tolerance or receptors. So I'm going to get an object that is soft and sharp and have my patient let me know which side is soft and which one is hard. So this would be soft, and this would be hard, and this would be soft, and this would be hard. Okay, perfect. And now I'm going to assess my patient's range of motion, and I'm going to have my patient demonstrate as I demonstrate, and we're going to do flexion, extension, supination, pronation, abduction, adduction, and circumduction. And I have now completed a full assessment on the patient. Is there anything else that you need? No, I'm going to make sure that the that doesn't want to go up. I would make sure that the bed rail is up, and that the bed is in the lowest position, and that the patient has the call light. And that is it.